Thank you very much, Dr. Ajay sir, Dr. Balaji sir, and Dr. Anupam Podder sir. I want to ask Professor Dr. Ajay Kubavat sir again about the calculus prevention under fixed retainer. So is there any new conception about it?
Yes, nice question. I being a professor and head in one of the college, I still, if at all, patient had a precondition, which is a spacing or a severe crowding. If there is a severe crowding, I always send them for precision in most of the cases because that works wonder. Whereas in cases of diastema, if there is a diastema, then I advocate that you would need a fixed retainer. But if you go through the systematic reviews of the same thing, you will come to know that whatever you say, even with the 3D printed fixed retainer, even if you use a 3D printed thinnest retainer, obviously it is going to harbor some of the plaque, eventually a calculus, which is generally supragingival, but at the lingual surface of the lower anterior teeth, a mandibular anterior teeth, it is very easy to recede, the gums there, and it would lead to when you try doing scaling and polishing in such cases, most of these cases end up, I'm talking about my own experience, most of these cases would end up with a little bit of hypersensitivity. That is again, something which was not there, and then you'll have to tackle with it. So my suggestion that if at all you are giving a fixed bonded retainer, make it a habit and protocol and explain to the patient that you'll have to use floss every day. You'll have to, if at all you're affordable, you can start using the water floss also, right? And make sure that you go and show your dentist or an orthodontist at least once in 6 months, and make sure that those dentist and orthodontist uses the plaque disclosing agent, and let them check it thoroughly and do the scaling prophylactically. Then there won't be a problem. This is my protocol.
Thank you, Professor Dr. Ajay Kubavat sir. দর্শক, আমরা আমাদের আলোচনার শেষ পর্যায়ে স্যার কিন্তু আমাদেরকে জানালেন যে আসলে আমাদের স্যার আমাদেরকে জানালেন যে আমাদের হচ্ছে স্থায়ী পদ্ধতিতে আঁকাবাঁকা দাঁতের চিকিৎসা করার সময় দাঁতের প্লাক বা পাথর পড়া কিভাবে বন্ধ করা যায়, এবং সেক্ষেত্রে ফ্লসিং করার কথা স্যার জানিয়েছেন, এবং ওয়াটার ফ্লসিং যদি পসিবল হয় সেটা করার কথা জানিয়েছেন, এবং প্রতি 6 মাসে অন্তত একবার চিকিৎসকের পরামর্শ নিতে হবে, এবং সে অনুযায়ী আসলে ওরাল হাইজিনটা মেনটেন করতে হবে। আমি আমার পরবর্তী প্রশ্নের জন্য যাব ডাক্তার মাহমুদ সাজেদিন স্যারের কাছে। স্যার, আজ আমরা অনেক কথা বলেছি আঁকাবাঁকা দাঁত এবং মাড়ির রোগ সম্পর্কে। স্যার, আমাদের আয়োজনের শেষের দিকে, আমরা আয়োজন শেষ করার আগে স্যার আপনি যদি কোনো তথ্য, কোনো পরামর্শ যদি যুক্ত করতে চান আমাদের আলোচনায়, অথবা আমাদের পুরো আয়োজন শেষে স্যার আপনার মন্তব্য প্রকাশ করতে চান দর্শকদের সামনে, স্যার সেটা জানতে চাই।
আমার মন্তব্য হচ্ছে এটা খুব ভালো একটা সেশন, খুব এফেক্টিভ একটা সেশন, আমি ইংরেজিতে বলি, both for the professionals and general dentists and also for the patients, because if they are listening to this, they will have some information. Professor Kubavat lastly concluded that sometimes we are bound to give fixed retainer because there is chances of relapse. Some cases there is chances of relapse is more, we are undone, we have to give. But in those cases, make the patient aware that this is something extra, because usually with normal patients, we almost with every patient will find calculus in the lower jaw, lingual side of the lower jaw. So if we put a retainer there, the chances of deposition of plaque and calculus is more. So if we can make, when we treat a patient, we can judge that whether he or she is capable of keeping her oral hygiene well or not. If we see that he can do it, then maybe we can choose for these fixed retainers. Otherwise, it's better not to go, because that will eventually, he may lose 1 or 2 teeth. That will be disastrous for us. So, and about the program, what I want to tell is we have learned many new things, many new dimensions, and the establishment of this interrelationship is a must. it is not yet well developed in our country. But after listening to this program, what I feel that after taking decision of orthodontic treatment, we must refer to the patient to the periodontist to get an idea of whether just to assess the status of the periodontium, whether we should go for treatment or we should wait, because as far as I have learned, that if a progressive lesion is there, it is not a good time to start the treatment with, because we are burdening a tooth with load. So if the tooth is not healthy, that means the gum is not healthy, it won't be able to sustain those pressure. So to do good to the patient, we may harm the patient. So thank you everyone once again. It was a nice session. Thank you and good night.